Hey guys, it's Dr. Christopher Wellwood from the Regenerative Medicine Institute. Today I'd like to talk to you a little bit about something that you might not think of as regenerative in nature, meaning that we repair certain things. However, I assure you it has a lot to do with chronic pain syndromes. Some of you have been my patients for years, and some of you are new. And either way, I hope that you understand that I'm always constantly striving to do better by you as a clinician. One of the things that I did a few years ago is actually graduated from a master's degree program in advanced clinical practice. And what that does is it allows me to be able to talk to you in the best way possible that gives you the best options available for treatment. And during that program, we were actually required to submit papers for publication. And I just happened to get mine actually accepted. So one of them is in this. Now, this is a internationally known medical journal. It's called the Integrative Medicine, a clinician's journal. And I was published in it in the June and July edition of 2014. And one of the really neat things about it that for me personally is that I actually get to see my name in the publication, but that also that I get to show patients what it is that I actually can do, and to assure you that you are seeing the best in the area, in my opinion, of course, for certain conditions. That's my article. It's basically on adrenal and thyroid supplementation. And I'd like to talk to you just a little bit about it today, particularly because it has to do with chronic pain syndromes. See, when a patient comes in and they say they've actually had pain for a long periods of time, whether that's 2 weeks, 6 weeks, 10 weeks, 2, 3, 4 years, whatever it is, there's always an underlying condition that might be associated with that. And when we talk about pain, we're not only talking about pain mechanisms themselves, but also about the hormonal regulation of pain. And one of the things that I learned during my master's degree, as well as my year of clinical neurology afterwards, is that pain, although is a physical manifestation, it is also emotional and mental manifestation, and it controls a variety of different things in your body, not only how you react and how you function, but also your activities that you do and the quality of life that you wish to obtain. One of the things that I often talk about with chiropractic patients as well as my regenerative medicine patients is that why is it that your body was perfectly able to deal with pain situations when you were 16, 18, 21, whatever it is young that you think, why is it that you were able to deal with those types of issues at that time? You're eating the same things, you're doing the same things, but now, 20, 30, 40, 50 years later, you're not able to actually handle. During my clinical studies, and what this article actually showed is that your adrenal system is directly related to the amount of pain that you might obtain and that you might experience. One of the reasons is that there's a hormone called cortisol, and cortisol is actually produced at night. So if you're not sleeping more than 6 to 6.5 hours of sleep, you're not producing enough cortisol. Cortisol is an anti-inflammatory and pain modulator that your body actually creates during stressful situations, whether that's physical stress or chemical or emotional stress. So if you're not producing enough cortisol and you get damage during that period of time, then your body uses that cortisol and in order to make you feel better. And if you're not getting enough sleep and you're not producing enough cortisol, it doesn't actually have the ability to create more cortisol to the level that it actually needs to. So if you're always running in a deficit, you're not getting any better, and you just feel like crud all the time, then your adrenal hormones might actually be tanked out. Now, one of the bad parts about this, among other things, is that it can often take between 6 to 9 months before you actually feel better. However, with proper management, with proper treatment, with proper home exercises and home remedies, you can have that amount to 3, 4, 5 months. Now, of course, that depends on exactly what it is that you're complaining about. Is it widespread fatigue? Is it widespread pain? Are you having joint pain? Are you having pain down the arms and hands? All those things actually will determine how long it is that your adrenal systems actually control itself. But one of the things that we found in my study is that not only is the adrenal system actually correlated by pain syndromes and pain and vice versa, but that oftentimes thyroid conditions can actually mask adrenal issues. So if you're feeling tired and fatigued and widespread pains and achiness all over the place, and you've been diagnosed with a thyroid condition, well, I gotta tell you, you might actually have an adrenal issue. You know that you're going to have an adrenal issue if when you take medications, it just doesn't get any better. Or when you have all the signs and symptoms of a thyroid condition, weight gain, lethargy, fatigue, dryness and brittleness of the hairs, loss of the lateral third of the eyebrow, brittleness of the hair kind of clumps out, sex drive's gone down, you can't lose any weight for whatever it is that you do. Well, you might actually have subclinical thyroid conditions or adrenal issues if your labs are completely normal. And labs, according to the medical profession, is just the TSH. I don't even want to get started right now. I will talk to you about that later. So if this is interesting to you, one of the things that we actually do here is we actually reduce inflammation and pain, thereby actually improving the quality of life. So we do that by several ways. We do immune system modulations through IV nutrition. We do ultraviolet blood irradiation. We do acupuncture. Chiropractic's been shown to actually increase adrenal systems, and massage. So some of the things you can do at home: Tai Chi, yoga, regular exercise, even though when you're feeling like crud. All those things can actually help. If you'd like to know more, don't hesitate to give me a call. Send me a message on Facebook. Send me a video blog. Whatever it is that you'd like to do to get a hold of me, call 509-299-6900, and I'll be sure to help you out, or at least see if that's something that I can help you out.